Hi everyone, my name's Dr. Mark Ettensohn. Welcome to Heal NPD. This is part 2 of a 4-part series exploring the narcissistic personality style across different levels of severity. In part 1, we explored psychotic level NPD and laid the foundation for understanding the core concepts used throughout this series. If you haven't seen that one yet, go check it out first. I'll put a link in the description. Today we're exploring narcissistic personality disorder organized at the borderline level. We'll talk about what that means and why it's important. Along the way, we'll explore how identity develops, what defines personality disorders, and why so many personality disorders share overlapping symptoms. By the end, you'll have a much better understanding of what separates narcissistic traits from full-blown NPD and why there's real hope for meaningful change through treatment. So let's get started. In part 1, we talked about the difference between personality style and personality organization. Personality style looks at the core conflicts and beliefs that sit at the very center of someone's personality. For example, narcissistic styles are focused on self-esteem issues, depressive styles on feelings of loss, and paranoid styles on perceived threats. But personality style alone doesn't tell us whether someone is healthy or dysfunctional. In fact, most people have a mix of personality styles, although there's typically one that's more prominent. They're like different shades on a color wheel. Each has its own hue, but none is inherently better or worse than the others. If we want to talk about health versus dysfunction, then we need to look at personality organization. Using the color wheel metaphor, if personality style is like the hue of a color, then personality organization is like the color's saturation. It indicates how intensely the core conflicts of a personality style affect the person's overall mental health. Whether or not we consider someone to have a personality disorder depends on their personality organization, not their personality style. It tells us how deeply the core conflicts penetrate, how much anxiety or distress they produce, and how effectively the individual manages them. Personality organization describes a person's object relations. Object relations is a broad construct that includes self-image, the ability to see the self and others in flexible and accurate ways, and the relationships between different parts of the self, including the internalized relationships we all have inside of us from childhood. At the higher end of this spectrum, we find mature object relations, where self-image is well-defined, stable, and integrated, and where there's an ability to relate to others as whole people who are separate and distinct from the self. At the lower end, we find immature object relations, where the boundaries between self and others are blurry, the distinction between internal and external experience is not well defined, and conflicts dominate the personality. This is the actual definition of personality disorder. It's not based on the personality style. It's based on the individual's ability to cope. It's not the color, it's the saturation. Specifically, personality disorders occur exclusively in the 2 lowest levels of personality organization, which are called psychotic and borderline. Last time we discussed the psychotic level, where identity is fragile and where there's little to no distinction between inside versus outside the self. Thoughts, feelings, and perceptions from inside the mind may feel as though they're happening in the external world, or vice versa, and this creates psychotic experience. Psychotic organization is marked by the use of immature defenses that distort reality and break the personality into disconnected fragments, creating confusing and disjointed states of mind. These issues resemble the kinds of experiences that are thought to occur in very early childhood, when the dividing line between the self and others is still fluid and unstable. Given good enough experience, most individuals develop a core identity or self-image. This core self-image is a crucial step toward developing well-defined, stable object relations. Without it, self-experience is continually created and lost, like designs on a sandy beach that are simply washed away by the tide. Sanity requires a kernel of self that is stable and not subject to invasion or contamination by the external world. Once such a kernel is reliably established, the individual's object relations progress from psychotic to borderline organization. Borderline organization isn't the same as borderline personality disorder, or BPD, although BPD gets its name from this level. Borderline organization sits, quote, on the border of psychotic organization. It's an in-between level, where reality testing is mostly intact but still unstable. The boundaries of self are blurry and still somewhat variable, and parts of the self remain unintegrated with the rest of the personality. The fundamental issue here is self-definition. The blurred boundaries between self and others cause a constant struggle between feelings of separateness and feelings of symbiotic merger, with neither state feeling totally comfortable. Psychologist and author Nancy McWilliams writes, "The borderline person alternates between symbiotic attachment and hostile, isolated separateness. Both states are upsetting. One raises the specter of engulfment, the other of desertion." End quote. We aren't necessarily talking about physical experiences of separation or merger, more like subjective feelings of isolation versus belonging. In borderline states, there's an internal drive toward self-definition that's counterbalanced by intense fears of abandonment. The person is caught between the need to be a separate self and the feeling that the self can't survive on its own. Borderline individuals rely on others both to provide organization and cohesion to self-experience, and also to function as a sort of surface against which the self can be contrasted and defined. Increased self-definition brings feelings of isolation and emptiness, a state that James Masterson called abandonment depression. Experiences of closeness dissolve into feelings of engulfment, triggering aggressive attempts to separate, while fears of separation lead to desperate attempts to merge. In narcissistic personalities organized at this level, ambivalence between merger and separation manifests as cycles of idealization and devaluation. Idealization seeks merger, and devaluation seeks separation. The blurry, ambivalent self-experience that characterizes borderline organization is called identity diffusion. According to psychiatrist and psychoanalyst Otto Kernberg, quote, "The presence or absence of identity diffusion differentiates borderline from non-borderline character pathology." End quote. People with identity diffusion struggle to see themselves and others in a clear, consistent way. Their descriptions of themselves and other people can feel contradictory or one-dimensional. Individuals with identity diffusion may also change their self-concept in reactive or even extreme ways, redefining who they are and what they want from moment to moment and situation to situation. I've heard such individuals describe themselves as chameleons or people-pleasers, able to adopt whatever qualities seem necessary in the moment. Sometimes this is conscious, but often it's not. McWilliams writes, quote, "The experience of self is likely to be full of inconsistency and discontinuity. When asked to describe their personalities, they may, like psychotic level patients, be at a loss. And when asked to describe important people in their lives, they often give global, dismissive descriptions." End quote. Borderline organization is thought to reflect a failure to develop the ego functions that are required to maintain a fully individuated and integrated self-image, one that doesn't repeatedly collapse into merged states where the self is confused with others. Numerous theorists have pointed to an early stage of psychological development called the rapprochement subphase as the most likely point of fixation. The rapprochement subphase occurs around age 2, and during this time, young children want autonomy but fear abandonment. It's a time that's marked by extreme power struggles, pushes toward independence, and pulls for closeness. Successfully navigating this period requires a lot from caregivers: patience, flexibility, firm boundaries, clear communication, warmth, and the ability to tolerate being raged at by someone who also needs you desperately. If successful, then children emerge with a flexible and independent sense of self, one that permits them to create increasingly coherent and integrated object relations as they grow into adulthood. We need both merger and separation to build a positive, stable, individuated self. But the right balance is highly individual. It depends on the child, the circumstances, and the stage of development. For example, babies need concrete experiences of merger because they help establish a baseline of love and safety that serve as a foundation for selfhood. But children in the rapprochement subphase have already developed a basic sense of self, and they now require encouragement toward autonomy, plus warm reassurance when they become overwhelmed. Too much merger discourages further development of an autonomous self, resulting in continued identity diffusion and profound reliance on others. Too much separation creates a false self in the child that pretends to be independent when it's still symbiotic. This is a common configuration in NPD, where the child has endured pervasive lapses in attuned empathic caregiving. Being misunderstood, mischaracterized, or overvalued for parts of the self while undervalued for others produces premature and traumatic experiences of separateness that require the child to construct a defensive island of self-experience, one that can function independently. This false self becomes very good at reflecting what the environment seems to want, and is thus able to receive limited, conditional love and approval. However, the island of false self exists in a sea of identity diffusion. Parts of the self remain stuck in a symbiotic mode of object relations, unable to cohere and individuate because the necessary relational experiences are simply not available. The false self might appear to function quite well. There can be insight, limited use of mature defenses like intellectualization, and a clear, albeit grandiose, self-image. Otto Kernberg writes, quote, "Patients with borderline personality organization typically present identity diffusion, but narcissistic personalities present an important complication in this respect. The narcissistic personality usually has an integrated self-concept, but the concept is pathological and grandiose." End quote. However, the false self is prone to collapse during periods of emotional overwhelm, when the individual is plunged back into the sea of identity diffusion, often causing severe depression, anxiety, and reliance on borderline-level defenses. The right balance between merger and separation is hard to strike. Luckily, things don't have to be perfect, just good enough. There will be times when the caregiver's response doesn't match the child's needs, creating experiences of separation. But those must be counterbalanced by an overall sense that the self is safe, understood, and loved. Some children need more merger, some more separation. The most important factor seems to be the goodness of fit between what the child needs and what caregivers provide. When there's a significant mismatch, relational trauma can occur, causing immature object relations to persist into adulthood. That being said, there is a wide range of severity within the borderline spectrum. When most people imagine someone with a personality disorder, they're likely picturing someone at the mid to lower end of this range. At the higher end, individuals may have surprising levels of insight, using a mix of immature and healthier defenses. Recognizing borderline organization in high-functioning individuals can actually take months of therapy. Borderline organization can be recognized by the frequent use of certain psychological defenses. These defenses are caused by the issues with identity and boundaries that characterize borderline psychologies. The Defense Mechanisms Rating Scales, or DMRS, categorizes borderline-level defenses as, quote, immature, and this reflects the developmental arrests that contribute to borderline psychologies. Most immature defenses have both borderline and psychotic versions, with the key difference being the extent of reality distortion. Psychotic defenses cause significant reality distortions, while borderline defenses create only minor distortions. In fact, the first category of immature defense on the DMRS is called minor image distorting defenses. These defenses protect the individual from experiences that threaten self-esteem, such as failure, criticism, or disappointment, and they include idealization, devaluation, and omnipotence. Idealization. At the borderline level, idealization is unrealistic, but not significantly reality distorting. Flaws are usually acknowledged, but sort of glossed over or dismissed as unimportant. The main function is to counterbalance deeper feelings of worthlessness or vulnerability. For example, someone with NPD might idealize a new boss, viewing them as the ultimate authority figure who can do no wrong. They might say things like, "My boss is a genius, everything they touch turns to gold," or "They're the smartest person I've ever met." This idealization may help the individual feel more important by association, as if their connection to this powerful figure elevates their own self-worth. Idealization is also used in other personality disorders. For instance, individuals with BPD often idealize new romantic partners, while those with depressive personality disorder may idealize past relationships or qualities of the self that now feel irretrievably lost. Devaluation. This is the opposite of idealization. It's when an individual attributes exaggerated negative qualities to themselves, others, or objects. Through devaluation, they can feel powerful over others or in control of perceived flaws in themselves. It can also defend against disappointment or shame over unmet emotional needs, sort of like saying, "I didn't need that person anyway," to avoid grief. Popular representations of NPD focus on devaluation of other people, the so-called discard phase, when the idealizations or love bombing shift to harsh critical treatment and the person or relationship is suddenly viewed as entirely bad or worthless. However, devaluations of the self also occur in NPD, particularly during the vulnerable phases of the disorder, when the individual is at increased risk for depression, anxiety, self-harm, or even suicide. Devaluation is used in other personality disorders as well. Individuals with BPD may devalue themselves or other people when they feel abandoned or rejected. Individuals with depressive personality disorder often devalue themselves in order to control the pain of a traumatic loss. Individuals with obsessive-compulsive personality disorder may devalue people or situations that they see as messy, unclean, or defiled, and individuals with dependent personality disorder may devalue themselves while idealizing the object of their dependency, preserving a feeling of powerlessness while basking in the idealized glow of their love object. Omnipotence. This is when individuals cope with emotional conflict or stress by exaggerating their own power, abilities, or influence. This allows them to feel superior to other people, as if they possess special skills, intelligence, or authority that somehow set them apart. Having an inflated sense of control or invulnerability protects them from deeper feelings of inadequacy or worthlessness. In NPD, the grandiose self-image is typically comprised of omnipotent and idealized attributes. Someone with NPD might insist that they're always right, that their way is the best, or that others should simply defer to their better judgment. Such demands often defend against an underlying negative self-image and deep insecurities. Omnipotence is also used in other personality disorders. Depressive individuals often take too much responsibility for failures or disappointments, and this leads to exaggerated guilt and feelings of worthlessness when things go wrong. Individuals with BPD may unconsciously believe that they can, quote, make someone love them, and antisocial individuals often believe they're superior and entitled to control others without consequence. The next category focuses on disavowal defenses. These defenses protect the individual from upsetting or threatening realities, but they don't usually involve psychotic distortions of reality. They include denial, projection and introjection, and schizoid fantasy. Denial. This is when an individual refuses to acknowledge or accept upsetting realities in order to avoid emotional distress or protect their self-esteem. Denial operates at an unconscious level, allowing the individual to maintain a distorted or selective view of themselves, their relationships, or the world around them. At the borderline level, denial is not significantly reality distorting. It's more like not noticing something that's upsetting, or not feeling as though the upsetting thing were real. It can involve refusing to believe facts or evidence, minimizing the consequences of behavior, or refusing to acknowledge difficult emotional truths. Individuals with NPD often refuse to acknowledge personal flaws or vulnerabilities that threaten their self-image. They may dismiss valid criticisms as jealousy or ignorance, or they may deny the emotional impact of their behavior on other people. They may also use denial to avoid responsibility for harm caused in relationships. Denial is also common in other personality disorders. Depressive individuals may refuse to acknowledge their own positive traits. Paranoid individuals may deny the possibility that people around them actually have neutral or even positive intentions. Dependent individuals may deny their capacities for self-sufficiency, downplaying any signs of personal strength or competence in order to preserve a powerless self-image. Projection and introjection. Projection involves attributing qualities of the self to other people, while introjection is the reverse, incorporating the qualities of other people into the self. Projection is a way of unconsciously expelling unwanted aspects of self-experience. In borderline personalities, the self structure is unable to balance internal contradictions, so boundaries of the self are sometimes redrawn to externalize negative qualities or experiences. Basically, it's not me, it's you. Because they represent parts of the self, these projections can't really be gotten rid of, and they must be projected repeatedly to maintain the illusion. Projection leads to interpersonal conflict, creating cycles of blame and misunderstanding. The person projecting is not able to see the true source of the problem within themselves. In NPD, projection is used to maintain a favorable self-image by disowning threatening feelings like jealousy, inadequacy, or shame. By externalizing these emotions, the individual can avoid the distress that comes from recognizing these traits within themselves. For example, someone with NPD may accuse other people of being weak or inadequate rather than confronting their own feelings of insecurity. But the door swings both ways. Introjection is where an individual unconsciously adopts the thoughts, behaviors, or attitudes of another person, often someone significant in their life, such as a parent, authority figure, or partner. Instead of projecting unwanted feelings outward, introjection involves internalizing qualities or attitudes of other people, making them part of the individual's own self-concept. Basically, it's not you, it's me. Introjection can also serve protective and adaptive functions. It allows us to maintain emotional closeness to important figures, particularly in childhood, by internalizing their values, beliefs, or behaviors. However, it can also lead to difficulties if the internalizations are negative or harmful. For example, if a child introjects the harsh criticism of an abusive parent, then they may develop punitive, self-critical attitudes. Sometimes these are so strong that they can cause suicidal ideation or self-harm. In NPD, introjects form the basis for positive self-object experiences, so-called narcissistic supply. This is when compliments or admiration are internalized as parts of the self. However, because the introjects are parts of another person that have been sort of claimed for the self, the individual can't sustain the self-esteem boost and constantly needs fresh admiration to maintain the illusion. Projection and introjection are also widely used defense mechanisms across different personality disorders. Schizoid fantasy. Schizoid fantasy involves retreat into an inner world of fantasy to escape from overwhelming, stressful, or threatening real-life situations. This defense allows the person to avoid dealing with external pressures, conflicts, or relationships by immersing themselves in imagined scenarios where they feel safe, powerful, or in control. While adaptive in childhood, persistent use of schizoid fantasy in adulthood often signals significant difficulties with emotional regulation and interpersonal relationships. For individuals with NPD, particularly those with interpersonal avoidance or a secondary schizoid personality style, schizoid fantasy can be a primary coping strategy. They may spend hours absorbed in grandiose fantasies where they see themselves as powerful or attractive. For some individuals, fantasies may also contain themes of revenge, and these are used to cope with feelings of inadequacy, envy, or rejection. The final category is major image distorting defenses. Here we find two defenses that really define the borderline level. They're called splitting and projective identification. Splitting. Splitting is the key to understanding many of the instabilities that we associate with personality disorders. It causes fundamental divisions in the individual's self-image and perceptions of other people. Splitting is often mistakenly called black and white thinking, but it's more than a cognitive issue. It's an identity disturbance. In borderline organization, the self is unstable and prone to overwhelming emotions and polarized perceptions. Upsetting experiences aren't just uncomfortable, they often feel traumatic. As BPD expert Marsha Linehan describes it, quote, "They're like people with third-degree burns over 90% of their bodies. Lacking emotional skin, they feel agony at the slightest touch." End quote. Splitting helps contain the devastation and pain by separating parts of the self into isolated containers, sort of like siloed parts of the self. Internal communication between these parts is often limited. Such divisions or splits in the personality protect the person from being overwhelmed by trauma-bound images of the self and other people. Splitting is remarkably effective, but it's also costly. It's a defense that we all use in early childhood. It allows us to preserve self-esteem and to protect important attachment relationships by keeping the bad separate from the good. We avoid the anxiety or confusion that comes from recognizing both positive and negative traits in ourselves or other people before we have the ego function to balance these contradictions. Over time, most people integrate positive and negative feelings into a cohesive whole. But in borderline organizations, this ability is not reliably developed, often due to chronic relational trauma or adverse childhood experiences. The person gets stuck with polarized, all-or-nothing views of the self and other people that limit insight and cause significant interpersonal disruptions. Relationships become a cycle of repeating traumas as the individual shifts between idealizing and devaluing internal states. One moment, they may see themselves and other people as good, but a small trigger, like a tone of voice or a phrase, can cause them to shift to the negative side of the split. From this perspective, the self is experienced as weak or unworthy, and other people as hurtful or dangerous. In that moment, they believe these perceptions completely, leading to extreme behavior like yelling or sobbing, hurling accusations, or devaluing the entire relationship. Later, they may be unable to connect to what they thought or did in this state of mind. And this is one reason that apologies from individuals with borderline organization can feel shallow, why they can't seem to sustain meaningful change, and why they can seem to be completely in love with someone one minute and absolutely hate their guts the next. It's important to understand that none of this is performative. It isn't a form of deception. The individual who is splitting sincerely believes their all-or-nothing worldview in that moment, and they typically have little to no insight about the extreme dichotomies in their thinking and behavior. In NPD, splitting may manifest as swings between a grandiose and devalued self-experience. When praised or admired, the person may feel grandiose and superior, but when criticized or faced with failure, they may feel humiliated and worthless, leading to sudden devaluation of themselves or other people. This devalued self-image is often filled with feelings of rage, shame, and unmet emotional needs. Otto Kernberg writes, quote, "At the very bottom lies the image of a hungry, enraged, empty self, full of impotent anger at being frustrated and fearful of a world which seems as hateful and revengeful as the patient himself." End quote. Splitting is also a hallmark defense in BPD, where it drives much of the emotional dysregulation and dramatic behavior that characterize the disorder. Projective identification. This defense exemplifies the blurred boundaries of borderline organization. It involves unconsciously projecting unwanted feelings, thoughts, or parts of the self onto someone else, and then interacting with that person in such a way that it pressures them to feel those projections as though they were their own emotions. For example, someone with NPD might project feelings of worthlessness or inadequacy onto their partner, and then behave in a way that causes their partner to actually feel worthless. In this way, the partner identifies with the projections. They take them on as their own feelings. Sometimes the popular concept of narcissistic abuse is used to describe the cumulative effects of projective identification in a relationship, where a significant other or family member has been heavily criticized or provoked to the point where they begin to doubt their own reality or self-worth. However, projective identification is not specific to NPD. It's also encountered in other personality disorders. Although it can seem confusing, there's nothing magical going on here. It's entirely possible to perceive someone through the lens of your own unconscious conflicts, and to treat that person in a way that causes them to feel whatever it is that you are trying not to acknowledge in yourself. In early childhood, projective identification can be beneficial, because it conveys emotional experiences to caregivers that the child is too young to articulate. The infant's cries create a feeling of emergency or distress in the caregiver that is similar to the child's internal state. Projective identification serves a similar function in therapy, where challenging patients often provoke the therapist to feel the same feelings of powerlessness, ineffectiveness, or anger that the patient is trying to manage in themselves. Recognizing these provocations as a regressed form of emotional communication has helped countless therapists better understand the inner lives of their borderline patients. All of these defenses mildly distort reality, blur the boundaries between the self and others, or disrupt the continuity of self-experience. And this is what defines them as borderline-level defenses. They reflect identity diffusion, lack of clear boundaries, and emotional and psychological confusion. Most of them are also interpersonally provocative, creating dysfunction in relationships. Many of them involve mistaking something that's inside the self for something that belongs to other people, or failing to recognize the complexity of human emotions and motivations, instead collapsing situations into oversimplified, polarized perceptions that cause others to feel blamed or misunderstood. These unconscious distortions can lead to maladaptive or even harmful behaviors that seem reasonable to the person in the moment. They push perceptions of the self and of other people into extreme categories. Those in relationships with such individuals might reasonably conclude that the person is actually a diabolical liar and manipulator. When the individual is wildly derogatory and devaluing one moment, and then shifts to viewing themselves as the aggrieved party in the next moment, it has every appearance of intentional and cynical manipulation strategies like gaslighting. I'm not attempting to excuse manipulative or abusive behavior. In most circumstances, individuals with borderline organizations have sufficient contact with reality to be accountable for their actions. But borderline issues do involve significantly skewed perceptions of the self and others, and reliance on unconscious defense mechanisms that blur boundaries and that prevent the individual from having full awareness of what they're doing and why they're doing it. It's a level of object relations where reality floats in and out of clear focus. When emotionally overwhelmed, the individual may regress back to a level of object relations that is basically psychotic. And when things are going well, they may appear to function at or near the neurotic level, where the self-concept is integrated and stable. It's a confusing, somewhat disturbing range of psychological functioning. So what does someone with NPD look like at the borderline level? Well, remember, in borderline organizations, the person's core conflicts and preoccupations dominate the personality. In NPD, this means that all or most of the person's perceptions, thoughts, feelings, and behaviors will in some way be about self-image and self-esteem. Borderline organization is also marked by internal instability, so the individual's self-image may be widely variable, moving unpredictably from the heights of grandiosity to the depths of shame and self-loathing. The period or frequency of these transitions varies from person to person, but all individuals with NPD organized at this level experience extremes in self-image that are distorted, yes, but that also retain some connection to reality. A smart person may consider themselves to be a genius. An attractive person may think of themselves as runway model material. Social interactions are also distorted, but loosely reality-based. Someone who gave the person a compliment might be described as obsessed with them, etc. Negative self-perceptions are similarly distorted. Whatever the valence of self-perception, be it positive or negative, it will also be unstable and based on splitting. The person will alternate between grandiose and devalued splits in the self. Grandiosity is marked by idealization, omnipotence, and denial of emotional needs. The person may experience soaring self-esteem, expansive attitudes and behaviors, feelings of superiority, or omnibenevolence. Or they may experience disdain for people onto whom they've projected feelings of worthlessness or inadequacy. In grandiose states, the person may have no memory or subjective awareness of ever having felt differently, which can lead to outrageously insensitive or cruel behavior. The subjective dissociation from any and all vulnerability or emotional need make it difficult for individuals in grandiose states to empathize with other people or to offer a sincere apology for their actions. It really is hard to overstate the euphoria of grandiosity in borderline-level NPD. However, the inherent instability of grandiose self-perception can also cause anxiety and pressure to, quote, perform. Such pressure is itself destabilizing and typically hastens the inevitable collapse into vulnerable self-states. The inflated self-esteem of narcissistic grandiosity relies on the defenses we've discussed to continually deny, project, or split off insecurities and vulnerabilities. But eventually, such feelings become overwhelming, leading to self-esteem collapse. Now, on the other side of the grandiose vulnerable split, the person with NPD is exposed to devalued or empty self-experience that is dominated by attachment anxiety, rage, dependency, shame, and overt mistrust of other people. Feelings of inadequacy, insecurity, and social anxiety become prominent. They may also experience illness anxiety, paranoia, panic attacks, and depression. The collapse into vulnerability is made worse by the pressure that the individual feels to get back to the grandiose self-experience. They may feel as though they've somehow lost their, quote, real self, even though what they're experiencing in collapse is simply the other side of the coin. Vulnerability in NPD can involve hopeless, empty, agonizing states of mind. Those around the individual often notice the stark contrast between vulnerable and grandiose states, but the individual themselves may not notice. They may deny or minimize the differences, failing to recognize the obvious cycles of self-esteem inflation and self-esteem collapse. Those around them may also try to help with reassurances and emotional support, but they're often met with help-rejecting behaviors that actualize the individual's feelings of hopelessness. The only real solution is treatment. The therapist and patient together must weather these storms of grandiosity and collapse. During periods of grandiosity, the therapist must find ways to hold onto the reality of the patient's vulnerability. And during periods of vulnerability, the therapist must find ways to hold the patient's hope. The goal is integration, to forge a more stable, realistic, coherent self-image that is well-defined and better able to tolerate and contain the core conflicts that define the narcissistic personality style. According to McWilliams, quote, "The aim of therapy for people with borderline psychologies is the development of an integrated, stable, complex, and positively valued sense of self." End quote. Such work can take a long time, and there may be periods, especially at the beginning, when it seems like things are actually getting worse. As the individual's defenses begin to break down, they're often exposed to underlying negative, devalued images of the self and other people. There are typically numerous unconscious attempts to sabotage, disrupt, or terminate treatment because it doesn't feel to the person that anyone, themselves included, could survive the full weight of unprocessed emotion that lies buried in their vulnerable self-experience. The only way to treat the disjointed internal experience of borderline organization is to go through it. It's a collaborative endeavor between therapist and patient. Such a path can seem hopelessly tangled. But when we reflect on the relational experiences that produce mature object relations, we see a similar tangle. It's just spread out over the years of early childhood. Feelings of hopelessness, terror, rage, dependency, distorted self-perceptions, confusion, emotional dysregulation, and immature coping are frequent features of early childhood experience. In borderline organizations, the environment wasn't a good enough fit to help the child with these feelings, and the individual grew into an adult who continues to struggle with them. In treating borderline issues, both the therapist and patient are exposed to powerful and intense feelings, contradictory perceptions of the self and other people, and limit testing that would absolutely destroy normal relationships. These issues require the boundaries and safety of a therapeutic space, and the training and insight of a therapist who can recognize the pushes and pulls for what they really represent. McWilliams writes, quote, "Along with integration goes the evolution of a capacity to love other people fully, despite their flaws and contradictions, and the ability to tolerate and regulate a wide range of emotions." End quote. The ego functions that help us to integrate and individuate are forged through relational experiences. We internalize these capacities from those around us, a phenomenon that Heinz Kohut called transmuting internalization. In time, it is possible to bring the siloed parts of the self together and to weave an integrated tapestry of self-experience. Individuals with borderline organization can learn to see and love themselves and other people in 3 dimensions. These capacities are not forever out of reach. They've simply not yet been developed. Okay, so that's it for today. The next video in this series will explore the narcissistic style organized at the neurotic level, where self-image and boundaries are much more stable and well-defined, allowing the individual to experience new feelings that weren't possible before, such as grief, and paving the way for the use of more sophisticated defenses that are also less disruptive to relationships. As always, if you found this video helpful, feel free to give it a like or to share with your friends, and until next time, take good care.